Hello everyone, I'm Dr. Vinay, sports physiotherapist. Welcomes you all in this lecture. So this is the official channel of TRM, the Rehab Physiotherapy and Sports Injury Center, so which is located in Kanpur. So we'll be talking about role of sports physiotherapy in sports. So the lecture topic will be role of sports physiotherapy in sports. The audience will be young athletes, players, coaches at a sports academy or any field. So what is sports physiotherapy? The question arises that what is sports physiotherapy? So, a sports physiotherapist is a specialized branch that focuses on just not preventing the injuries, to diagnose the injuries and to rehabilitate and make the protocol for assessing the injuries, and rehabilitation protocol has been made by physiotherapist. During any physical activity, if any injury could happen, so the sports physiotherapists are the first line defense, that they will going to treat and assess, evaluate the injury and rule out the red flags associated with them. But it is not just about treating the injuries. So it is also about enhancing your performance and boost your recovery. Football player on field. So I am assessing a football player and applying ice on his ankle. So what happened here is severe ankle sprain was there. So during chasing the ball, so his ankle got twisted and he got a grade 3 ankle sprain and of ATFL ligament and CFL ligament grade 2. So why we are applying ice here? So let's see. What happens is, on in grade 1 and grade 2 tiers, we will not apply. The recent evidences says grade 1 and grade 2 tiers we will not apply ice immediately during the injury. Why? Because it delays the healing. So it delays the healing process. So as we all know, grade 1 and grade 2 tiers can heal up more fast than the grade 3, which is complete tier. Okay. So in grade 3 we can definitely apply ice because it will going to take time to heal up and rehab protocol. So the rehab will definitely goes for 2 to 3 months. But for grade 1 ankle sprain we will not apply ice because it can definitely heal within 1 to 2 weeks. So ATFL ligament is assessed via anti-drawer test, which is similar to the anti-drawer test at the knee joint for ACL injury. And calcaneofibril ligament can be tested by tailor tilt test. We will definitely invert the foot into inversion position, and if there is sharp shooting pain on the lateral malleolus, there will be the test will be positive. What are the different goals and objectives of sports physio? So here, what is the role of sports physio in team or any sports academy? So they will work on injury prevention, they will work on immediate injury management, rehabilitation, and prehab. What is prehab? Prehab is rehabilitation before injury, or we are basically training a athlete to not to have an injury. So post rehab, that is post injury rehab, performance optimization, psychological and support, athlete confidence, individualized athlete care, return to sports decision making. Now we will definitely one by one look at the role of physiotherapy. So first of all, we'll talking about the injury prevention. So as athletes, your body goes into intense stresses. So physiotherapy helps to understand your body mechanics, identify the muscle imbalances, improve the posture, identify the biomechanical faults related to the sports or any muscle imbalances during any physical activity due to compensation or due to injury. So improve flexibility and strength. So with proper guidance, we can help you reduce the risk of injuries like sprain, muscle pulls, or joints injuries. So remember, prevention is always better than cure. Now, injury management and rehabilitation. So when injuries occur, whatever it's an ankle sprain, ligament tear, or overuse injury, sports physiotherapist leads to rehabilitation process. So using evidence-based protocol, they ensure gradual or safe return to sports while minimizing a re-injury. For example, ACL rehab includes phases focusing on range of motion, strength, neuromuscular control, or sports-specific drill. So these are all phases of rehabilitation. You can see that is first of all we will improve the range of motion. Then we will work on the strength, that is the muscle which was atrophied during the injury or which got weakened during the injury after the injury due to several traumas. So we will definitely develop a neuromuscular control or proprioception, and then we will definitely work on a sports specific drill and then return to sports. Now rehabilitation. So a physiotherapist has a crucial role in developing a structured rehab program based on the type of severity of injury. So monitor progression and modify rehabilitation protocols accordingly. He also incorporates sport specific drills for return to sports preparation. Performance optimization. So physiotherapist works closely with the coaches to enhance key athletic traits like mobility, proprioception, strength, and postural control. So this not only improves a technique but also delays fatigue and improves endurance. Example: optimizing shoulder stability in throwers improves power and reduces strain on the shoulder. So psychological support and athlete confidence. So injuries affect both body and the mind. So physiotherapy supports athletes through mental challenges during rehab, help build confidence, motivation, and trust in their body. Again, individualized athlete care. So each sports position level an athlete is unique. I mean, I'm talking about basically sports. That is, different sports has different challenges, different hard work, different kind of injuries, and different position means level. Kind of that is if the player is district level, so that must be trained less, or the player is of national level. So the training intensities level might be different. So athlete is unique. So every athletes their confidence, their psychological aspect, their diet, and their way of training is different. So physiotherapy tailored training and recovery based on a sports specific demand, which is vital in elite and young development. So how return to play decision making has been done. So return to play is a very crucial thought basically because we have to take decision whether the athlete can play or not. So it's all totally not depends upon us. There's a team. This is also a team approach, but during the on-field assessment, we are managing the injuries on the field. This is our call that we will decide the athlete or the player will going to play or not. If we will say no, you can't play because you are having severe injury, then they will definitely get out of the match. But if we can think that he can play or she can play, she is well fit or not having serious injury, then we can proceed with the return to sports. So it can be basically two types, or short term return to play, that is during the game, or return to play after the injury, that is long term return to play or return to sports. So use objective testing to assess and rule out the red flags. Basically, this what is the meaning of this? This can be done both on the on field or as well as the off field. How? I mean how? So you during on field, let's say if the ankle got twisted during the football match, so let's say grade 3 ankle sprain is there. So we will definitely look or assess the severity of the ankle laxity, or you may say which kind of grade of injury. If the grade 2 or below injury is there, we will proceed with the return to play, or if the grade 3 will be there, then severe laxity will or instability will be there, we'll definitely say that you can't play. So that's how we can plan and rule out the red flags. So athlete confidence is the major role play. Here, some athletes can be fearful that how I could play with this injury. So the level of confidence can determine the return to play. So criteria for return to sports. So there are different criteria or different specific drills for ACL, that is single hop, triple hop, or crossover hop, that determines that is if there is remaining or the healing has been occurred or not. So specific special test. So special test, if there is no pain with the special test, then we can proceed to play. Coordinate with different sports physicians like sports medicine specialist or nutritionists or other strength conditioning coaches can help us a lot. Other specific role of sports physio. So education. Conduct a workshop for athlete or injury prevention and recovery. Awareness. Guide athletes on hydration, sleep, overtraining prevention. Documentation. So a detailed record of injuries, intervention and progress must be done. Communication. Collaborate with team coaches, trainers, nutritionists and doctors like sports medicine specialists. Each athlete confidence and trust. So promote long-term athlete development. What are the takeaways that you can take with you with this lecture? So prevent and manage injuries. So physiotherapist focuses on preventing and managing the injuries. They also focus on speed up safe recovery, enhances athletic performance, guides us return to play decisions, so promotes long-term health of the athletes. So always keep in mind that physiotherapy is not just about treating injuries. It's about keeping athlete on field at the best and injury free. So our main goal is to just free the athlete from the injury. As soon as the injury will occur, they will definitely decline their performance. So we will have to make him injury free. Whatever you are training, competing or recovering, your physiotherapist is a key part of your team. Train smart, play hard, recover right. Here are references. Thank you so much, guys. If you have doubt, you can comment me on the comment section. We will definitely come up with some interesting lectures on the next lecture. Thank you so much. Bye.